Hello, all, and very beautiful Sunday morning to you all again. And today we are here for our episode 93 of Instagram Live Guest Talk with Homeopathy Heals. Today we'll be discussing about unexplained infertility. Let's add very dynamic. She's very talented.
Hello, ma'am.
Ma'am, you there? आपका मैम आ नहीं रहा है स्क्रीन पे. I would like to ask the audience, can you see both of us? No problem. BMS student can also join. MBBS students, practitioners can also join. Unexplained infertility will be the same for any stream of medical treatment. I would request audience to let us know if you can see both of us on your screen. मैम मैं आपको देख नहीं पा रही हूँ. Can you please leave and join again?
Okay. Are you able to see me?
Yes, ma'am.
Okay.
A very warm welcome to you, ma'am. Before we start the session, I would like to introduce our guest of the week today. She is very young, talented, and dynamic Dr. Poornima Battala. She has done her MBBS from Osmania Medical College and MS OBG from SVS Medical College Hospital. She has done her fellowship in reproductive medicine. She is also a member of IFS Society and faculty in various national conference and consultant fertility and IVF specialist. She is currently working at Zivia IVF Center, Pune. Again, warm welcome to you, ma'am.
Thank you so much for your kind introduction, ma'am. And it's great to
So, ma'am, we have selected today's topic where everyone, they just drop their weapons, and you know, we have picked up today's topic where rarely people have answers. So, if they're able to explain 95% things, our today's topic lies in only just 5% thing. So, ma'am, my first question, goes to you is why we have picked up this topic, unexplained infertility, and what is unexplained infertility from a desk of an expert.
Okay. So unexplained means I'm getting lot of sound. Are you fine, ma'am? Okay. Unexplained infertility basically means that when we have done the basic test for a couple, all the tests comes out to be normal. But that doesn't mean that everything is normal with the couple. That means that there is definitely an issue with the couple. That's why they're not able to conceive. But what is the issue or the reason behind the infertility can't be diagnosed by the routine test. That's why it is called unexplained infertility. It means that definitely there is an issue with the couple which needs a treatment. But though that cannot be identified by the routine test. In our medical field, there are some conditions which we know the diagnosis, but we don't have the treatment. In infertility, we have the treatment, but we don't know the exact reason behind it. Sometimes diagnosing will be more expensive than the treatment. So that's why it is termed as an unexplained infertility. For usually the couples, if they have the regular unprotected intercourse, 80% should conceive within 1 year. Among the 100%, if you take the 100 couples, 80% will invariably conceive within 1 year. That means 12 cycles of natural intercourse. And the rest 10% will conceive in the following year. So 90% should conceive in the first 2 years of their marital life. If they don't conceive, there seem to be some issue. It could be the issues with the ovulation. Some will be having regular cycles and they can't have the regular intercourse. The timing may be missed when the ovulation occurs. So in these cases, we do a simple follicular monitoring. That means that we will be identifying when the ovulation is happening, then we will ask the couple to try naturally. So if that is an issue, that should be covered by that treatment. In some couples who has some issues like tubal factor, some issues like male factor, जिनका sperm counts थोड़ा subnormal है, motility subnormal है, some issues with the semen analysis and some cervical factor भी है, तो वो IUI से correct हो जाता है. वो IUI से correct हो जाते हैं. जिनका semen analysis normal है और रेगुलर ओवुलेशन भी हो रहे एंड ट्यूब्स आल्सो शोज पेटेंसी, मतलब ट्यूब्स भी नॉर्मल है, जिनमें प्रेगनेंसी नहीं होने के लिए चीजेस एक्सप्लेन करना डिफिकल्ट होती है. द रीजन फॉर इनफर्टिलिटी इज बियॉन्ड द बेसिक टेस्ट. जो भी बेसिक टेस्ट है ना, हस्बैंड को इवैल्यूएट किया तो भी नॉर्मल है, वाइफ का रेगुलर साइकिल्स है, ट्यूब्स भी नॉर्मल है, स्टिल दे आर नॉट कंसीविंग. सो दीज केसेस आर कॉल्ड अनएक्सप्लेन्ड इनफर्टिलिटी. In those cases, the reasons might be sometimes even when we do an IVF, we see the follicles on the scan, but we don't know whether the oocyte egg is there in the follicles. जब हम aspirate करते हैं हमको पता चलता है कि अरे स्कैन में follicle है बट उसमें एग नहीं है, और एग का क्वालिटी बाहर निकालने के बाद ही हमको पता चलता. एंड बॉडी में एग और स्पर्म मिलना, दैट इज कॉल्ड फर्टिलाइजेशन, वो नेचुरली हो रहे नहीं हो रहे हमको नहीं पता. सो these are all the factors which happens in your body that might not be happening in the proper way. That's why that might be a reason for your infertility. So this is in just what is unexplained infertility for you. And
That's actually very true. What I have seen in my practice, if I'm allowed to say this in your session, I have seen females going through lot and lot of investigations. I just had some online consultation where female has done even hysteroscopy also, and it was unexplained. And when I asked about your partners, male reports, that have you done the semen analysis, male is not ready to go for investigation. So whenever I encounter a case of infertility, I make sure that investigation of a male partner is done prior, before we start even the ovulation monitoring of a female.
yes, totally agree with you.
I
Because
mean, they are not even ready,
yes,
they are not even ready to give semen sample for analysis.
yes.
Yeah, I even don't know the mindset what they have.
That's a taboo with the society. But I feel that this is can you mute your, yeah, that's a taboo with the society. I think this trend is becoming more and more better and the people are accepting it. And some set of people, some communities were initially, as you said, they were very reluctant to get the semen analysis, and wife has to go for monthly scan, sonography and the painful HSG and everything without one semen analysis of the husband. Everything होने के बाद we will get to know that husband has with severe low counts or zero counts पे. There is no point in treating the wife or blaming the wife for getting so much of done. So, and semen analysis is basically to understand, it's a very basic test. It is not at all invasive and nothing, there is no harm in giving the blood semen analysis, or it is neither invasive or neither painful, nothing is. So I prefer at the first visit, semen analysis should be done, and the female scan is the basic thing for the infertility evaluation. It's a first step. The vaginal, transvaginal sonography for a woman and a semen analysis for the male. When these things are good, when the female ovarian reserve is good, and apart from the routine investigations like after getting investigated for the hemoglobin, sugars, thyroid, prolactin, if everything is good and her reserve is good and husband semen analysis and wife ovarian reserve is good, then we can easily go ahead with the trying the follicular monitorings for 3 to 6 cycles. So before going for the vaginal scans every month, it is mandatory for the husband to have a semen analysis one. Previously, we didn't have enough technology or enough expertise in getting semen analysis, but it's not the thing right now. Even a small center, and everyone has an capability of doing a semen analysis. So it has to be evaluated at the very first step.
I have also encountered cases where, most of my male patients, they are not reluctant to give sample at centers. I don't know, they feel so uncomfortable and they don't know the value or the necessity or the time duration where the sample is transported from their house to the center will definitely change the results and the reports.
Yes.
So, counseling and educating patient is equally important when it comes to investigations.
Yes. Yes.
That when and how this investigation or when and how this examination under what circumstances will get a appropriate result.
Yes. So let me some light on the semen analysis collection and investigation. So first, when you are advised to get a semen analysis, you should have minimum of abstinence period of 2 to 5 days. That means you should have a gap of minimum 2 days and not more than 5 days. Because if you have too low gap, so we will be having false negative reports showing your low counts or low volume. If you are having so much of gap, we might have the false results showing so much of dead sperms and motility less and lot of debris and the dead cells. So minimum when you are planning to give semen analysis after 2 days, you need to have like intercourse with the wife or masturbate and waste a sample. Then on the day of the semen analysis, you should maintain minimum of 2 days gaps and not more than 5 days gap. And most of the center are like all the fertility centers are well equipped with a collection room, semen collection room, which provides you adequate privacy without much interference, and almost all the fertility centers have good collection centers also. We respect your privacy, and that is given utmost importance because that adds lot of stress to give the sample at the other center. We understand that, and we will be making you as comfortable as possible. But still, if you have any issues or collection difficulty in a new center, still you have an option of collecting the sample. You can visit the center and we will be explaining you the process, and you can collect the container from the center. Then you can collect the sample at home. Make sure that there is no spillage of the sample, and try to reach the center within 30 minutes. While traveling, keep the container to the body as close as possible and try to reach maximum by 30 minutes so that the results won't be much hampered. We'll be able to give the accurate results for you. So these are the basic precautions for the collection of semen analysis.
That was actually a good piece of information, for everyone of us. My next question goes is, in the market or on social media, there is a lot of, treatments or medicines or pills or diet, roaming all across the social media when it comes to infertility. So I would like to ask from you as an expert that how to improve the chances of fertility naturally.
Okay. So whatever chances of fertility, like to have a successful pregnancy, we need a successful embryo. Embryo comes from wife's oocyte and husband's sperm. So improving the quality of oocyte and sperms is very important. Previously, if you have noticed, the people from the village or tribal background, they don't have that much of infertility issues as compared to the urban population, because of the main thing is the lifestyle modification. They have healthy diet and adequate physical activity, which is lacking in the urban lifestyle. So going back to the roots, it is very important to have the healthy lifestyle. Healthy diet rich in antioxidants, consume lots of fruits and veggies and salads, and a protein rich diet. Like in particularly in PCOS and other conditions, PCOS, overweight, in those conditions you are definitely asked to switch to no carbohydrate diet. Carbohydrates should be minimal, and please consume lots of carbohydrates and healthy fats, and lots of foods rich in colorful fruits, colorful vegetables. That means that the colors is proportional to the antioxidants present in it. And nuts, sprouts, they have rich source of proteins. Then physical activity. Minimum of 30 to 45 minutes of physical activity per day. Especially in PCOS, in whom the ovarian cycles are irregular, they, in spite consuming very low calories, tend to gain weight. If they gain weight, their cycles become irregular and oocyte quality comes down. And when the oocyte quality comes down and the PCOS gets worse, and again they tend to gain weight. If they gain weight, the PCOS gets worse, PCOS gets worse, gain weight. It's a vicious cycle. We need to break that cycle. So what to do in particularly PCOS cases? Low carbohydrate diet, weight loss, exercise, and high protein diet. If you do exercise in particularly PCOS cases, exercise is not only for the weight loss. Exercise causes insulin, breaks the insulin resistance, and then it improves your PCOS and also the egg quality. And overweight and lot of smoking, alcohol consumption, they also had lots and lots of studies indicating that they impact on the sperm quality. Smoking, though, I'm completely against smoking. Smoking has to be completely quit if you are seriously planning for the fertility. Alcohol, occasional alcohol or social drinking is acceptable, but not on a regular basis. And if you are overweight also hampers the sperm quality. You need to maintain the ideal body weight and maintain 30 to 45 minutes of the physical activity, and diet, of course, it plays a very important role.
Ma'am, my next question is very basic, and it is for both the doctors and normal public also. Most of the people, they don't even know when to see a fertility specialist.
Okay.
Okay, so some people, they might come to you when the family force them, or I mean, when a couple should feel that they should see a fertility consultant.
Okay. I feel like usually the infertility is when a couple is diagnosed as infertility only after 1 year of unprotected intercourse. Then they definitely need to meet a physician or a fertility specialist. But once a woman age is 35 years, or when they're having a known issues, like any case of fibroids or endometriosis or PCOD or any known tubal block or a history of tuberculosis, they have to meet as quickly as possible, immediately after marriage, whenever they are planning for the pregnancy. Or if they're somewhere age less than 30 years, then they can wait for 1 year, try naturally. If not successful, they can meet a physician. But now recently we have been seeing many couples, even younger as 25 to 30 years, they're having very low reserve. Ovarian reserve indicates that they're having less eggs for their lifetime. If you are having less eggs, you have a very low fertility potential and you are going to menopause very quickly. So whoever wants to delay the pregnancy, that means who are in early 30s or early 20s, late 20s, who wants to delay the pregnancy, just have a fertility consultation with your doctor and make sure that everything is fine with you with regarding your ovarian reserve. Everything is fine, then you can postpone your pregnancy. If there is an issue with ovarian reserve, based on that you plan your fertility early, or if you're married, you can go with an IVF, stimulate and prepare your embryos and just freeze them. Embryo freezing is an option available for you. You can freeze them. When you're totally ready for the pregnancy, you can get them transferred. If you're unmarried and if you want to delay your pregnancy more than 35 years or so, then you have an option of oocyte freezing. We can freeze your eggs also. So basically basically, if you are less than 30 years, if you are want to postpone your period, postpone your pregnancy, just meet a fertility consultant, make sure that everything is normal with you, and then you can postpone. Or else, till 1 year you can naturally try. If not, please meet a physician after not 1 year.
Ma'am, another question is my question which is I am very much confused about. I would like to know about what is AMH and what is AFC and what is the difference between them.
Okay.
Okay.
So, unlike males, women are gifted. Women eggs are precious and they are very limited. Males will be producing sperms for their 70 up to 70 to 80 years also. But in females, the eggs are very limited and the number of eggs for the lifetime has been already destined. So, what is AMH? Is an anti-Mullerian hormone. This hormone gives an idea of how many eggs are there for you and what is your ovarian reserve. This is very, very important because women till 35 to 36 years will be having good amount of the reserve. As age increases, the number of eggs and the quality comes down. And once after 38 or 38 to 39 years, the fall in the number of follicles is very drastic. So the quality. That's why the chance of conception after 35 years is very low, and also there is increased chance of miscarriage. So the blood test, anti-Mullerian hormone, that is AMH, and antral follicular count, that is a transvaginal scan done on the second or third day of your periods. So these two tests together will define you how many, what is your ovarian reserve, what is your reserve. Based on that, we can plan your fertility treatment. If you are having good result, we can go on with the treatments which have, even if it is a low success rate, we can spend some time and give you that. But when you know that your reserve is low, we need to speed up our treatment. When we know that reserve is low, we need to go for a treatment which gives higher success rate. So that if we waste our time, meanwhile, if your counts come down, even the quality and success with the other treatments or the higher treatments like IVF also, it decreases. So timely action is depends, and also the mode of treatment depends upon your ovarian reserve, which is mainly assessed based on the blood test called AMH and antral follicular count. This is particularly important when you cross around 35 years. After 35 years, when the reserve is very low, we can't go around doing the follicular monitoring and wasting your precious time and precious eggs. So we need to offer you a treatment which gives the highest success rate.
Ma'am, another next important question is what, according to you as an infertility expert, could be the reason for unexplained infertility?
I can explain. It's not mine also. It's from the worldwide. All the fertility specialists don't know precisely the reason for it. That's why they termed it as unexplained infertility. So there are some biological things happening in our body. They are different for different people. And we can't specifically say for why this is happening, because definitely there is a reason for it. Why in your body fertilization is not happening? Why in your body the ectopic is causing? Why is there is a damage to the tubes? Why is your egg quality poor? There are definitely the reasons associated with it. Matlab egg quality, there might be genetic factor associated with it, or there might be lifestyle modification, or might be food contaminants, or adulteration with the food, or lack of physical activity, and even we can't trust the air we breathe, or the water we drink, and the food we eat. It's not there, like 20 to 30 years, or you can say around 50 years, the infertility was not this rampant. The percentage of infertility has increased a lot because of all the environmental changes and lifestyle changes and everything. This affects our body in some manner or the other. That could be the reason for your poor egg quality and poor fertilization rates, poor implantation rates. But diagnosing what is the reason for your infertility is more expensive than going straight away for the IVF and correcting it. See, identifying why fertilization is not happening in your body is more expensive than doing an IVF, like picking up your eggs and taking the sperms and doing ICSI or IVF करके embryos बनाकर transfer करना. वो rather little lower on expense part than investigating it. And however, no one wants the investigations. Like they want a healthy pregnancy. That's right. So that's why it's unexplained. We are more focused on treatment and giving a healthy pregnancy. And to overcome all this, we empirically give that antioxidant tablets and the lifestyle modifications, which is a must for the fertility treatment, and whichever the individualized treatment which is necessary, we will go ahead and we'll do that. And all unexplained infertility also does not always go for an IVF. Some unexplained infertility will be overcome by IUI, some unexplained will be overcome by the follicular monitoring, and only unresolved or long-standing infertility, then they might end up having an IVF.
I'll be picking up one question from the audience. Dr. Mehra is asking, ma'am, please explain what to do in cases where clinical PCOD is present but patient is having no symptoms.
So clinical PCOD, that means on the sonography you are having high number of follicles, but still you are having regular cycles and no signs of upper lip hair, chin, acne. If you don't have anything, that is a good PCOS. That is early stages of PCOS, but still it is well balanced. So what we can do is we can maintain the lifestyle changes like as I said, you low carbohydrate diet, exercise, and weight loss. And then you can go ahead with the follicular monitoring when other things are ruled out. Just get the tubal factor is good and husband factor is good. Then you can go for the follicular monitoring and try for about 3 to 6 months. That should be fine actually.
Now there's another question from audience. Please explain about chocolate cyst.
Okay. Chocolate cyst is endometriotic cyst. That is completely different entity. Endometriosis means when you have a menstrual bleed, there is a bleeding in the ovary. It's a condition called endometriotic tissue will be growing in the ovary and they form a chocolate. They long standing blood collects and it becomes dark colored and chocolate colored and they form the cyst, which is very thicker. We can't aspirate it. And as such, it's not the cyst. It causes lot of immunological, cytological changes in your body. It affects your uterus and ovaries. So based on that, वो उससे endometriosis के वजह से आपका egg का quality poor हो सकती है and endometrium में भी जब embryo आती है वो implant होने का potential भी कम होती है. So that chocolate cyst or endometriosis is divided into 4 stages. Each stage has a different mode of treatment. The stage, the size of the chocolate cyst. Some chocolate cyst is usually resolved by the surgery, simple surgery, and based on that you will be given a down regulation injection for 1 or 2 cycles and that should be done. Sometimes in some cases it will be recurring. Some cases it will be hampering with the infertility. Some cases you apart from infertility, some will be conceiving and they'll be having kids, but they'll be having cyclical pain, severe pain during the menstrual cycle. So this endometriosis has lot of variation in symptoms and signs, and it is individualized treatment based on your symptoms and your concern.
Ma'am, my next question is, will advanced treatment like IVF will work for unexplained infertility?
Is only the best option for unexplained infertility. In unexplained infertility, IVF में हमको follicles जब पिक करते हैं, follicles का हमको पता है, and follicles का quality, follicles में oocytes का quality directly will be seen through microscope, and we will be injecting each oocyte with a sperm, and will create the embryos. Among the embryos also we will see which embryo is good, and we will transfer only the best quality embryo. So unexplained infertility, the best option is the IVF. And IVF में unexplained infertility का success rate भी बहुत अच्छी होती है. It should be around 90 to 95%. When everything is good, IVF works well for the unexplained cases.
There is one question. Someone asked that, ma'am, after embryos are made outside and when they are transferred in a female body, what precautions, can be taken after fetus transfer?
So after embryo transfer, usually I don't prefer the strict bed rest. वो इमीडिएटली आफ्टर एम्ब्रियो ट्रांसफर, एम्ब्रियोस बहुत माइक्रोस्कोपिक है, वो इमीडिएटली इट गेट्स अटैच्ड टू द यूट्रस, उसके लिए कंप्लीट बेड रेस्ट लेने की जरूरत नहीं है. बट स्टिल आपका ट्रांसफर होने के बाद यू आर नॉट सपोज टू लिफ्ट हेवी वेट्स, और simple walking and day to activities are fine, but moderate to severe vigorous activity to be refrained from. And please make sure that you take healthy food, home cooked healthy food only, and please avoid outside food. Too much of spicy oily foods, please avoid them. And please try to engage yourself. I know that our embryo transfer is very precious for you, and you will be waiting for the results, but they don't take too much of stress, because stress factor also affects. Try to divert your mind, don't think about your beta hcg. Till then, engage yourself in some activity, keep yourself busy. And वैसे भी इसलिए मैं बेड रेस्ट नहीं बताती हूँ. बेड रेस्ट लिया तो they'll be thinking and get themselves so much of stressed out. And studies also proven that there is no role of bed rest after embryo transfer. So they can do their routine activity, just the physical activity, excessive physical activity to be refrained, and healthy diet to be maintained. That's the basic thing which I advise. And please take the regular medications. जो भी medications आपका hormone medications and everything, वो appropriately, don't miss even a single dose of the medication. That's my advice for the patients.
I have seen so many patients, even I ask them when they undergo treatment of infertility that don't think much, don't think stress. But what I have seen, mostly females, they are quite more stressful when it comes to infertility treatment. And even if it is unexplained and everything is normal, uh, do you have, being a infertility specialist, although not a psychologist or clinical therapist, but do you have any answer to this, how not to take stress when a couple is going through infertility treatment?
See, some couples usually who are a working woman, I know they have to have a couple of visits to the clinic, and they will be hampering their work will be hampering. So they usually prefer to completely leave their job or put a complete leave. I am against that. Please continue your own job, and also like just engage your activity. If you are sitting idle at home, we develop more stress about it. That's why please continue your routine office work or anything. If absolutely, if it is very stressful for you, that's another thing. But try to engage yourself and stay in a place surrounded by people, and go to some meditation or yoga classes. That would be helpful for you. And positive.
There's another question. How many times a woman can go for IVF, and what are the complications post IVF?
IVF usually it's a treatment which is minimal complications. IVF may you'll have it temporary complications, like because of the injections your ovaries will be swollen, and you will be having temporary discomfort or abdominal pain discomfort only for a couple of days. That is during the peak of your stimulation, and after pickup everything will be normal. These injections which we give in an IVF, they're very short living, very short acting. That's why we need to give everyday injection. The action is only for 24 to 48 hours. So there is, and absolutely there is no long-term side effect of the injections. Usually people undergo for 4 to 5 cycles or 5 to 6 cycles, and previously there were studies like multiple cycles. Is there any risk of ovarian carcinoma? But currently there is no proven side effects that if we have more IVF cycles, they have increased risk of ovarian carcinoma. Right now there is no long-term side effects with IVF treatment. Short-term side effects being some amount of the abdominal discomfort, some nausea, vomiting, that too only for a couple of days. That's it.
And how many cycles a woman can undergo IVF?
It's definitely, there is no, it is subjective to the patient and their preference. Abhi kya hai na, if we know that definitely like किसी का रिजर्व अच्छी है, good reserve, when we get poor oocytes, then we try to change the stimulation and change the protocol, and we do something different so that we don't have the similar result. We'll try to get good oocyte. In that condition, we can do 2 or 3. If we are having it after the third cycle also, we are getting the similar results, like very poor quality oocytes or all the follicles are good, and there is no point in troubling the female again and again. But in those cases whose ovarian reserve is low, they're having hardly 3 or 4 follicles. But each time we are getting 1 or 2 embryos, then for the pulling up of embryos, even if we go for 4 or 5 cycles of stimulation, that is worth of trying. So, how many cycles of IVF? There is no limit on that. We can go ahead. Currently, as I said, there is no limitation, and it is not going to hamper women health with more number of stimulation cycles.
Okay, so I think we have covered all the questions from audience as well. So it was indeed an amazing session and very eye-opening as well. So we are here, marking the end of the session. And I'm so much grateful and thankful to you, ma'am. You have spared your valuable Sunday. I know how busy infertility consultants are, and they just get one single day as their off, or probably some oocyte pickup or transfer comes up, and you have to rush. So
I should be thankful to you, Dr. Anum, for introducing me to so many people. And it's been a great session, and you have been so proactive and energetic, and it's great to be associated with you, in fact.
I would like to share one thing which I have learned personally with Dr. Poornima. When it comes to IVF centers, or reaching out to infertility experts, okay, people have a mindset that as soon as you go to an infertility expert, they will they will put you under table of IVF and you will be forced to undergo IVF. But I would like to tell you, this is something which I have perceived, being in connect with so many infertility consultants as my colleagues, as my seniors, that they try to go by basics like other doctors. There is no point of getting scared that meeting a infertility consultant will you'll end up into an IVF procedures or advanced treatment only. They also go by basics. They check your nutritional values, they check your hormones, they check any pathology. They also go by first step first. So reaching out to any fertility consultant does not mean that you are going to have a child by IVF or any advanced treatment on only. You should trust your physician, you should trust your consultant, and they are not moduled like a robots that a patient has, okay, patient आ गया है तो अब इसका IVF ही करना है या इसका procedure ही करना है या इसका surgery ही करना है. I have seen lot of patients, couples conceiving just by getting a good counseling and good antenatal vitamins in their routine and schedule, by just maintaining a good lifestyle. Am I right or not, ma'am?
Right, you had emphasized a very right point, and that's very true. See, in this busy lifestyle, when everything is normal with a couple, they are not having the time to have the regular intercourse, that is around at least 3 to 5, 4 days of intercourse per week. They're not able to maintain that because of the busy duty schedule and the timings. They're not able to meet up. In those cases, also, like just a follicular monitoring or basic thing is also going to help you a lot. So it's not like we have a basket of options, and not all the patients are for IVF. We first assess you. We do an individualized protocol-wise treatment, and we will assess you based on the age, nutrition, BMI, that means the body weight content, and based on that your ovarian reserve, and we suggest you the best option. The least best option we will be suggesting you, only we will be stepping up our treatment only based on your response. And it's not that IVF center is for only for IVF. It's not. It's a complete fertility center. We will be assisting in your fertility and helping you to try naturally. Only when the natural modes doesn't succeed, then we'll go ahead with the higher modes after discussing the pros and cons and all the consequences, and after a detailed discussion with you, then the treatment will be going ahead.
Thank you so much, ma'am, for our valuable guest on our show, and thank you so much for being here and enlightening us. I would be definitely sharing your post on the story. So if someone has more questions, they can mail you, or if someone wants a consultation, they can reach out to you.
Yes. So much for this wonderful Sunday and a healthy, like we had a very healthy discussion also. That's very grateful to you.
I am so much every time overwhelmed when I meet you personally, because apart from asking कैसे हैं और कैसे नहीं है, how are you, I am fine के बाद I always bombard you with lot and lot of questions, unending questions, and you're so being patient. Even your coffee is getting cold, even if your food is getting cold, or even if you're getting late for work, you're always so patient, answering all my questions. And I must say, you must be, dealing your patients the same way you are taking care of your colleagues and your juniors also. I am so much in depth and overwhelmed by the responses of, a specialist, super specialist consultant, I must say, in town. And you have set the standards so high that a fertility consultant should be like this, should be patient like you, should be giving answers, should be having a good counseling values as well. So thank you so much, ma'am, for always enlightening us. And
Thank
that's why
you.
I wanted to come over.
That's
That's
my
why I
love for
wanted
you.
you to come over a guest talk, because I have learned a lot from you, and I also wanted my students, my audience, my whole Homeopathy Hills family to know about that how a good infertility experts they look like.
Thank you so much. Your words made my day, really. I'm very overwhelmed by your compliments.
Thank you so much, ma'am. We'll definitely look forward to have more sessions with you
Thank
and to
you so
have.
much for having me here. Really I'm really thankful to you, Dr. Anum, and this is a wonderful day and wonderful having the interaction with you and your quest for the knowledge and your quest to share the knowledge with everyone and your enthusiastic work. Please keep it up. It's wonderful.
Okay, bye, ma'am. Thank
Bye.
you. Thank
Thank
you
you.
for having.
Thank you for the lovely audience who joined and had their queries. Bye.
So I hope you all have enjoyed. Do not forget to write us what you learned from today's session, and what are your feedbacks, what other topics you want to be covered. We'll soon be hitting century 100 episodes of our Instagram live guest talk with Homeopathy Heals. Thank you for all love and affection you all have given to us, and stay tuned. We'll be back with another good and blast episode. I'll be dropping in the story those who want to consult Dr. Poornima for any kind of query or for referring your patients. Stay tuned. Till then, stay fit, stay healthy, Homeopathy.